The other day, Ontario Premier Doug Ford made the controversial decision to keep schools closed for the rest of the school year, despite the fact that jurisdictions all across the United States and Canada have mostly managed to keep their schools open, and despite the fact that most pediatric experts in the province, Sick Kids Hospital, various other associations have said reopen the schools immediately. Every day counts. But Ford opted not to do it. But the question isn't just whether or not you support or oppose the decision. The question is, what was Ford going on about? And a number of remarks he made that I think really deserve some fact-checking. After that press conference, I heard from a number of medical voices, pediatric experts that I've had the privilege of getting to know the past number of months, and they were really concerned at some statements that were really misinformed that the Premier said. I'm going to walk you through a few of those statements that need to be fact-checked. One thing the Premier said, and he said this consistently, is, I don't want to risk the health of our kids. He makes it look like school reopenings are a direct threat to the health of our children. Now, parents would most likely not want to put their kids in a situation where they feel they are going to harm their children, but is that what's really going on here? We've actually had officials step forward over the months and show more and more evidence that suggests COVID-19, thankfully, is not all that serious in children. In fact, many pediatricians say it is less severe than influenza when it comes to children. Dr. Ronald Cohn, President and CEO of Sick Kids Hospital, previously told The Sun that that's pretty much the silver lining news, if there is one, to the coronavirus, that children, by and large, are not severely affected by it. And there's a lot of information that tells us more and more we learn that no children aren't hard hit by it. A new report that I reported on from the Public Health Agency of Canada found that actually the number of COVID hospitalizations of kids throughout the past year is grossly overestimated. The number itself is already lower than the number of kids hospitalized annually with the flu. However, what they found with this study is that only a third of kids hospitalized for COVID were actually hospitalized for COVID. The rest came in for things like broken arms and other ailments, and everyone has to be tested upon admittance to hospital and found, oh, this child tests positive even though they have zero symptoms for it. They just technically counted as a COVID hospitalization. Why is Doug Ford continually sounding the fear-mongering notes that opening the schools puts kids at risk, whereas no other jurisdiction in Canada and the US has really found that? Let's take a look at something else that he said, another claim he made. I'm really concerned about putting all of the kids in the classroom, again suggesting that there is sort of significant in-class transmission. But his own Chief Medical Officer of Health, Dr. David Williams, had said multiple times that there has been hardly any transmission at all in classroom all across Ontario throughout the entire course of the pandemic. Hardly any at all. And yet Doug Ford suggesting the opposite. But what's going on here, you say? Because we hear these reports that this number of cases in schools, that number of cases in schools. Well, Ontario actually counts cases in schools very differently than they do cases in, say, a manufacturing facility. For it to be ticked off on a box on the government database that there's been an outbreak in a manufacturing facility, they have good reasonable suspicion that the cases were acquired in that warehouse or facility. However, when you say cases in schools, it actually doesn't mean cases acquired in schools. The vast majority of time, what it means, and health officials have confirmed this, is that someone who attends the school environment has at some point tested positive for the virus. So they believe they got it from their parents, and well, they go to school, so they've said it's a case in school, even though they believe that child did not go on to transmit it to anybody. It's kind of like if after every person who tests positive for coronavirus, contact tracers ask them, have you been to a grocery store in the past 14 days? And probably most people would say yes. You would learn that your local Loblaws has 800 cases in it on any given week, even though those aren't actually cases that were transmitted in the Loblaws. I think it's very unfair, actually, what they do to kids in the school system, that they count it that way. I wrote a report recently on one East End Toronto school in the Danforth area that they found there was one student who tested positive for a new variant. So what they did is they had 300 students tested to see if they had coronavirus, and there were zero positive cases that came back. So a new variant in the school did not go on to transmit it to a single other student. Let's take a look at one more thing that Doug Ford said. School reopenings will lead to thousands of new cases. He's been talking about that. He's been tweeting it. Okay, well, that's not good. And he's quoting a science table stat that says it will actually cause cases to increase 6 to 11%. But a lot of pediatric experts were very confused by that because, as I just said, there's been hardly any in-class transmission at all. So where do they get this number from? How can reopening schools surge cases by 10%? Well, what a lot of experts believe is that because they talk about this number in a really odd way, they don't actually mean that those will be cases that develop in school or even from the kids, but rather that because the parents are no longer tied into the household to monitor remote learning, the parents are free to walk around society and maybe they'll interact with each other and maybe they'll catch coronavirus. So Doug Ford is actually talking about school closures as a population control measure for the adults. That's at least what it seems to be based on how a lot of people are sorting through that information. If that's true, I think he should come clean on all of that and break all that down so Ontarians can decide, wait a second, is that an acceptable reason to shut down schools? So a lot of things that Doug Ford said that really stoked unjustified fears, things that were not entirely correct and that definitely deserve people to give some second thought to and a bit of a fact check over.